I'm Dr. Opeolu Adeoye, and I will be speaking to Dr. Xin Cheng, who is the lead author of the CHABLIS-T trial. Dr. Cheng, thank you very much for taking the time to speak to us.
Thank you, Doctor. This is Xin Cheng from Huashan Hospital, Fudan University National Center for Neurological Disorders in Shanghai, China. I'm a stroke neurologist.
Thank you again, and first, congratulations on this outstanding work. And could you give us a statement or two about what the study was about and what you found?
So the study is about whether TNK, tenecteplase, is safe and effective for acute ischemic stroke patients in an extended time window that is 4.5 hours to 24 hours from the time of last known well with advanced neuroimaging selection. And in this phase 2A randomized multi-center open-label blinded-ended Simon two-stage umbrella design study, we use a combination of major reperfusion without symptomatic intracranial hemorrhagic transformation at 24 to 48 hours after intravenous thrombolysis with IHTNK-TPA as a primary endpoint. We found that those strata achieved substantial reperfusion without leading to symptomatic ICH if the patients were strictly selected using the advanced multimodal neuroimaging.
And thank you for that. And you mentioned both 0.25 and 0.32 milligrams per kilogram of tenecteplase. Could you speak to how you selected the dose arrangement in that?
So the investigative drug IHTNK-TPA, what we used in our study, is produced by a Chinese pharmaceutical company. And these two dosage are equal to the dosage, what we learn about the TNK global-wise, the 0.25 and 0.4 milligram per kilogram.
Okay, thank you again for that. And given the fact that both arms seem promising, how do you select an arm to move forward with, and what are your next steps?
And so actually in China, there's a phase 2 study completed and published using this TNK in the acute stroke patients within the time window. And they found that the 0.25 may be a bit better than the higher dose. So also in our study, although both of them are quite have satisfied our primary outcome, we try to use the lower dose. Maybe it's more safe, and we will move to our phase 2B study, which has been started last September, and we want to recruit more than 200 patients in our phase 2B study.
All right, congratulations again, and thank you very much for taking the time.
Thank you.